Okay, I'm in. And I got a pair of compulsive disorders here.
Van egy kérdésem. Hogy mondhatják, hogy a pszichiátria bizonyított, ha nincs bizonyítékuk?
Itt többről van szó. Nem csak, hogy a pszichiátereknek nincsenek vizsgálatai a zavarok bizonyítására, de még definíciójuk sincs a mentális zavarra.
Na ne!
Még a DSM-ben is benne van. Figyelj!
Although this manual provides a classification of mental disorders, it must be admitted that no definition adequately specifies precise boundaries for the concept of mental disorder. There you go.
Elképesztő.
Ám a pszichiáterek nem álltak itt meg. 14 évvel a DSM-3 megjelenése után kiadták a DSM-4-et. A főszerkesztője még nyersebb volt a mentális zavar kifejezést illetően.
There is no definition of a mental disorder. It's bullshit. I mean, you just can't define it.
Bevallották, hogy nincs meghatározások a mentális zavarra, annak ellenére, hogy a könyvük címében is szerepel, és mégis több zavart adtak hozzá.
Sokkal többet. Egészen pontosan 115-öt. Így összesen most 374 van a kézikönyvben.
Ez több mint 3-szorosa a DSM egybeliek számának.
Csupán 40 év alatt. És ez a könyv több mint 2 kilós.
Az nagyobb, mint a fővárosi telefonkönyv.
A zavarok vásárlói katalógusa. A használatával a világon 120 millió ember diagnosztizáltak mentális zavarral.
Hű, de mi van a BNO-val, a Betegségek nemzetközi osztályozásával? Abban is több a mentális zavar?
Határozottan. A BNO-ban felsorolt mentális és viselkedési zavarok szinte párhuzamosak a DSM-mel. Mindent, ami a DSM-mel történik, a BNO-ban is megismételnek.
Hát jó. Akkor eddig megtudtam, hogy nincsenek vizsgálatok a diagnózisok igazolására, hogy nincs bizonyíték a kémiai egyensúly hiány elméletére, és hogy nem tudják, mi a mentális zavar.
És ezt el is ismerik, legalábbis egymás között. Íme egy vezető pszichiáter egy közelmúltbeli konferencián.
You're sitting in your office, you see a depressed patient, you have no idea what's the matter with them. And I know all of you think you know the answer, but in terms of evidence, I don't know the answer, and I don't think any of us really know.
Ez elképesztő.
Ennek ellenére nagyon gyors diagnózisokat csinálnak. Íme egy másik befolyásos pszichiáter ugyanerről a konferenciáról.
Jim Burley at the Maudsley Hospital did a study once on how long it took people to make up their mind about the diagnosis after they entered a room, and it was about, how many, David? It was 2 seconds? It was a couple of minutes. It was very...
2-3 perc?
Aha, így van. Még az Amerikai Pszichiátriai Társaság egykori elnöke is elmondta, hogy a DSM igencsak nevetséges.
Well, what does D stand for? I used to think it is diagnostic, but over the last few years realized it is more like a dartboard.
Dartsjáték? Ezt a pszichiáterek a pácienseknek is elmondják?
Nem. Sőt, úgy tesznek, mintha tudnák, miről beszélnek, miközben a közönséget a ködben tartják.
I was sent to a psychiatrist who saw me again for maybe about 15 minutes, talked to me how I was doing at 7 years old, and I left with a prescription for Ritalin.
Probably within the first 15 minutes, he diagnosed me with having an anxiety disorder and put me on prescription medication.
The amount of time it took for the diagnosis was, I'd say, probably within 10 minutes I was diagnosed with anxiety, with depression, within 10 minutes of speaking to the psychiatrist, and I was put on those drugs immediately.
I received numerous different diagnoses from different doctors, and each one gave me a different drug.
I didn't have to undergo any tests. I didn't even have to sit there and I didn't have to ask any questions. It was just that's what you've got, and this is the drug.
They really didn't talk to me. They were always talking and questioning my mother. It was all about getting the information from her and not from me.
It doesn't make sense to me. I researched it, I've done my research, and I still can't fully understand how you can diagnose somebody with a short attention span.
There was never an explanation. Nobody really knew what it was or why it was caused or how did you get it, why did anybody have it, and what could anybody do about it? Just here, have some medicine and go away.
And I was put on, a horse's dose of an antidepressant called Effexor, 450 milligrams a day. They say if you're on 300, you're comatose.
It wasn't always Ritalin. It was
Went from Ritalin to like Wellbutrin to Concerta to Adderall.
I remember asking these doctors, is there any other way we can do this? Is there any other therapy? Is there something we can do that won't make me feel so badly, that won't give me all these side effects and just horrible sensations through my body 24 hours a day? Is there something else I can do that might be not having to do with medications? Doctor said, no. See, what you have is very complex. You have a chemical imbalance in your brain that the only thing that can correct it is medication.
Hű, csomó diagnózis, de úgy tűnik csak gyógyszert kapsz.
Úgy van. Napjainkban a pszichiátriai diagnózis egy pszichiátriai szert jelent.
The whole question then becomes, okay, if we apply these labels, what next? And the what next tends to be, you get a prescription. And the prescription is for a drug that doesn't work very well and is toxic.
It's like a 1-2 punch. The number one of the 1-2 punch is the diagnostic manual. You've got all these disorders to choose from. The two is the treatment. So you've got the diagnostic manual in place, you've got a machinery in place, and then you've got this treatment that is there for the taking.
For everything you can think of that might seem to be odd behavior, the psychiatry field has a name for it. And then for every name of every diagnosis you have, there's going to be pharmacology behind it, and they have a pill for it.
Let me fan it out and pick a card, and there you go. Here's your label, and there's the drug that we'll give you to go along with that label.
98%, maybe 99% of people will get a diagnosis that justifies the use of a medication and also a follow-up appointment. Because remember, the business of medicine, the business of psychiatry, is seeing patients. And the psychiatrist that tells a patient they don't have a problem and there's no medicine for that problem doesn't have a very busy practice.
And that's sort of the purpose of the DSM-345, to provide a diagnosis that can be given a drug for that patient.
It's a quick buck. You don't need to do a physical exam. You put it in the chart, it's done. Prescribe away. Lifetime patient. That's what the DSM is for.
Azt mondják, hogy a DSM csak a gyógyszerezés igazolására van?
Attól tartok, igen.
Hű.